When arthritis flares up, it can be tempting to reach for comfort foods, but your food choices can significantly impact your arthritis pain. In this video, I'll discuss the worst foods for arthritis pain and suggest healthier alternatives. Arthritis is an umbrella term for over 100 chronic joint disorders characterized by inflammation, pain, and stiffness in the joints. The two most common types are osteoarthritis, caused by the wear and tear of joints over time, and rheumatoid arthritis, an autoimmune disease where the immune system attacks the joints. Other types of arthritis include gout, psoriatic arthritis, and juvenile idiopathic arthritis, each with its own unique causes and symptoms. Worst food for arthritis. For a variety of reasons, here are the worst foods for arthritis pain, including rheumatoid arthritis, joint pain, and other arthritis symptoms. Be sure to watch until the end, where I share a list of the healthy foods that you should consume, including specific ones that may even help reduce inflammation and arthritic pain. A healthy diet may help reduce your symptoms. Food number 1, vegetable oils. According to science, humans evolved in a diet with a 1-to-1 ratio of omega-6 to omega-3 essential fatty acids. With the Western diet, that ratio has gone awry, and we tend to consume too many omega-6 fats and not enough omega-3. Among other things, this can increase inflammation, worsening the symptoms of osteoarthritis and rheumatoid arthritis. In order to correct the imbalance, it's good to work on ways of increasing your consumption of omega-3 rich foods and reducing foods that are high in omega-6 fats. Sources of omega-6 fatty acids include vegetable, sunflower, corn, soybean, and safflower oils. Omega-3 rich alternatives to try include olive oil, coconut oil, and butter. Processed foods. Multiple studies indicate that consuming processed foods can trigger inflammation, worsening arthritis symptoms. Processed foods include baked goods, many breakfast cereals, fast foods, prepared desserts, and microwave meals. These foods often contain undesirable ingredients like refined carbohydrates, added sugar, trans fats, and high levels of salt. Refined carbohydrates, found in cookies, cakes, candy bars, and similar desserts, are empty calories stripped of fiber, bran, and nutrients. Diets high in refined carbs have been linked to increased inflammation in people with arthritis. Additionally, refined carbs can increase insulin resistance and contribute to obesity, both of which are associated with arthritis. Trans fats, also known as partially hydrogenated oils, are often added to processed foods to extend shelf life. However, research shows that trans fats can trigger systemic inflammation, exacerbating arthritis symptoms. High salt content. Salt is another problematic ingredient for arthritis sufferers. Studies in mice have shown that a high salt diet can aggravate arthritis symptoms. Conversely, a separate study found that a low salt diet resulted in less inflammation and reduced bone destruction. Avoiding processed foods rich in refined carbohydrates, trans fats, and salt can help manage arthritis symptoms and improve overall joint health. Added sugars. There are many adverse health issues connected to consuming added sugars. A worsening of the symptoms of arthritis is among them. Refined sugar is known to cause inflammation, and a study involving more than 200 people found that desserts and sodas sweetened with sugar were the foods most often found to increase arthritis pain. Many foods high in refined sugars like chocolate, candy, ice cream, and soda are obvious. But you should also check the labels of foods like sauces too, as their sugar content can be surprisingly high. Don't forget that sugar goes by many other names, may appear as sucrose, fructose, maltose, or corn syrup on ingredient lists. Fried foods. The reason for avoiding fried foods is twofold. First, many contain trans fats, which, as we discussed earlier, can trigger inflammation. But the other problem is something called AGEs, or advanced glycation end products. These are molecules that form when certain foods, particularly high-fat animal foods, are fried, seared, or roasted. Some of the richest sources of AGEs are French fries, pan-seared steak, fried or roasted chicken, and bacon. High level of AGEs in your body can lead to inflammation and oxidative stress, which have been shown to worsen arthritis symptoms. Keep your AGE levels under control. Substitute fried foods with clean, whole ingredients, particularly legumes, vegetables, and fish. Instead of cooking with very high heat, prepare these foods by steaming, poaching, stewing, or boiling them. Or if you want that crispy texture to your foods, consider air frying. One of the pros of air frying is that you can get a great texture without deep frying. Allergenic foods. If you have a food allergy, whether it's to gluten, wheat, dairy, or another allergen, you might notice increased joint pain after consuming it. Allergens trigger the immune system, leading to inflammation throughout the body, which can worsen arthritis symptoms. It's especially important to avoid foods you're sensitive to if you suffer from arthritis. However, you don't need to have a diagnosed food allergy to benefit from avoiding certain foods. If you experience an inflammatory response after eating specific foods, you may have a food sensitivity, which also warrants eliminating that food from your diet. Rheumatoid arthritis, an autoimmune form of arthritis, may benefit from a gluten free diet or an autoimmune protocol diet, which can help reduce autoimmune markers. Individual responses vary, so consulting a functional medical doctor for specialized support is advisable. You might also consider trying an elimination diet, such as a paleo or a whole 30, to identify which food groups could be affecting your arthritis symptoms and overall health. Soda. As mentioned earlier, added sugars can significantly increase the symptoms of arthritis. One of the leading sources of added sugar is sugary soda, with the average 20-ounce bottle containing the equivalent of a whopping 16 teaspoons of table sugar. Choose water, coffee, seltzer, or herbal tea instead of soda. If you find water too plain, try infusing it with fresh fruit for a flavor boost. Tomatoes and nightshades. The advice around eating tomatoes and other nightshades like potatoes, bell peppers, and eggplants is mixed. Nightshades contain a toxin alkaloid called solanine. Some research has shown that vegetables containing solanine can affect the permeability of the intestinal wall, indirectly triggering inflammation. But a study involving animals contradicted this, finding that consuming nightshades could help reduce inflammation instead. This, of course, presents you with a quandary. The good news is that nightshades are a rich source of nutrients and well worth including in your diet if possible. So the Arthritis Foundation recommends avoiding all nightshades for a couple of weeks and then slowly reintroducing them one at a time. This will make it easy to identify any that are aggravating your symptoms. Excess alcohol. Moderate alcohol consumption is generally considered safe for arthritis sufferers and has been found to reduce the risk of developing the condition. However, excessive alcohol intake can be problematic, especially for those with gout, one of the most common types of inflammatory arthritis in the US. Alcohol can worsen gout attacks and increase their frequency. Additionally, a separate study has linked alcohol consumption with increased spinal damage in people with axial spondyloarthritis, a form of arthritis affecting the spine and the joints connecting the spine to the pelvis. High purine foods. As mentioned earlier, gout is a common and very painful form of inflammatory arthritis. If you suffer from gout, your healthcare provider may recommend avoiding high purine foods. Purines are chemical compounds that your body metabolizes during digestion. Excessive purine intake can build up in the body and form uric acid in the bloodstream, worsening gout symptoms. While purines are found in many foods, it's difficult to avoid them entirely. You can manage your intake to help control your condition along with medication. Foods high in purines include cured meats like ham and bacon, certain seafoods such as scallops, mussels, sardines, and anchovies, offal including liver, kidneys, and heart, and alcohol. Cauliflower, beans, and mushrooms are also high in purines. However, a review indicated that these vegetables do not seem to exacerbate gout symptoms. What are the best foods for your joints? A diet filled with clean, healthy ingredients, particularly one rich in plant-based foods and low in processed animal products, has been demonstrated to reduce the pain of arthritis. This is in part because it helps prevent inflammation, but also because a diet like this results in a lower BMI. Excessive body weight is known to make the symptoms of arthritis worse. Aim to include the following foods in your diet on a regular basis. Whole foods and anti-inflammatory foods can also have other health benefits, including helping with chronic conditions, disease control, blood pressure, and mental health. And of course, a well-balanced diet may help reduce joint inflammation. Fatty fish. To balance your omega-6 to omega-3 essential fatty acid ratio, increase your intake of omega-3s by eating more fatty fish. Omega-3 fatty acids are well documented to help control arthritis symptoms and are abundant in oily fish like sardines, salmon, tuna, mackerel, and herring. If you're not a fan of fatty fish or follow a vegan diet, great alternatives include flax seeds, walnuts, or their oils. Turmeric. The rich yellow spice used in Indian curries containing curcumin, which has significant anti-inflammatory properties. A study involving 139 people with knee osteoarthritis found that taking 500 milligrams of curcumin 3 times a day significantly relieved pain, comparable to the NSAID, but with fewer side effects. To maximize the benefits of turmeric, consume it with black pepper and or fats to boost absorption. Ginger. Research shows ginger can help prevent arthritis pain. One study found its effects comparable to ibuprofen for a limited time, while another found concentrated ginger extract useful for treating knee osteoarthritis. Additionally, ginger and echinacea supplements were found to reduce pain and inflammation after knee surgery. Nuts and seeds. Nuts and seeds are key components of the Mediterranean diet, which is rich in antioxidants that can decrease rheumatoid arthritis pain. Walnuts, chia seeds, and flax seeds are particularly good sources of alpha linolenic acid, ALA, an essential omega 3 fatty acid. Remember, nuts and seeds are high in calories, so consume them in moderation. An ounce of nuts or a couple of tablespoons of seeds is enough to provide the benefits you need. Choose unsalted or lightly salted versions to avoid excess sodium. Berries. Berries are excellent for combating arthritis symptoms due to their high antioxidant content and anthocyanins, which help reduce inflammation. Berries are especially beneficial, containing 20 types of anthocyanins compared to the 3 or 4 types found in other berries. Olive oil. Olive oil is another key ingredient in the Mediterranean diet, the benefits which I've already discussed. But olive oil is also a great source of oleocanthal. This is a natural compound found to decrease arthritis markers, and it contains anti-inflammatory characteristics similar to ibuprofen. In fact, it's the highest levels of oleocanthal that give it that mildly peppery taste. Plus, of course, olive oil is loaded with beneficial omega 3 fatty acids. It has also been shown to prevent cartilage damage caused by osteoarthritis. Garlic and onions. Garlic and onions both contain a useful anti-inflammatory compound for reducing arthritis symptoms, and that's quercetin. They also contain a compound called diallyl disulfide, which experts found has anti-inflammatory properties and can prevent the destruction of cartilage. But not all onions are created equal. Red and yellow-brown onions are believed to be the most nutritious varieties, and better than white onions for delivering the benefits you need. Your diet can significantly affect your arthritis symptoms, which is good news because it gives you some control over your condition and tools to manage your pain. Following a real food diet and maintaining a moderate body weight can reduce inflammation, relieve pressure on your joints, and greatly improve your quality of life. Thanks so much for watching. I hope you learned something today about what foods to avoid if you have arthritis or joint pain.